Dr. Jason Yakimishyn. Did I get that right?
Hey, very good.
Perfect. Yeah. I haven't had to say that in a little bit, but Dr. J, you're owner of Foundation Chiropractic in Oakville, Ontario. And, we've known each other for a little while now, and I understand that you are working with some teams, some baseball teams specifically, but there may be more teams than that. And so what we wanted to do is just chat a little bit about chiropractic care, how it can benefit a team, making sure that it's safe and appropriate for certain athletes. So before we kind of get into any of that, I just want to, maybe give a quick lead up or a quick bio, how you became, the owner here of Foundation, and how you got to be where you are at kind of today.
Yeah, sure, absolutely. So I think for me, it really started back when I met you, Sean, in London, or even before that, when I did my undergrad. I was doing my undergrad at Western Ontario Kinesiology. In my last year there, I was actually the athletic therapist for the football team that year. So that's really where I kind of got my feet wet in terms of the health and how it relates to an athletic performance standpoint and dealing with athletes. From that point, I was kind of deciding between physio and chiropractic. Dabbled in a little bit of both and got to experience both while working with that team, and kind of decided that I wanted to do the more chiropractic route. Just appealed more to me at the time. So went down to Life University in Atlanta, Georgia, played on the hockey team there, as well as provided chiropractic care to the hockey team, as well as their rugby team. So again, kind of dealing with a different set of athletes in a different sport, slightly different needs, different desires, but underlying still the same principles applied. Moved to London, and that's where I met you. Got involved in the CrossFit scene, so got into some of that side of things, more the individual sport type of stuff. Worked for a little bit there, and then when my sister graduated, who's also a chiropractor, we decided we wanted to open an office together. Moved to Oakville. My Oakville office primarily serves, just corrective family chiropractic care, but it does have, and I do have, an athletic emphasis. I'm also a part owner in an office, a sports rehab office called Apex Optimal Performance. That's located in Mississauga, so I do spend about 1 to 2 days a week there treating on the floor, as well as managing a team of about 15 practitioners now. So we have about 5 therapists. Yeah, it's grown quite a bit. It started with 5 of us, and it's grown to about 15. Physiotherapists, massage therapists, chiropractors, naturopathic doctors, and athletic therapists. That clinic's actually located within the Athlete Matrix, which is the GTA's largest indoor training facility. That started with the Ontario Blue Jays. They were the first team and organization that trained out of there, but it's grown to now house Pac-Man volleyball, Halton Hurricanes volleyball. There's a few different soccer clubs that train out of there. Damon Allen runs his CFL QB Academy out of there. So we're kind of the office that works with all the athletes. So without going into too much detail further, it's kind of been a whirlwind of things. I didn't expect to my goal was not specifically to search out these specific organizations and work like that, but I think my background in athletics and just being an athlete my whole life, and the networks and people that I surround myself with, the opportunities presented themselves, and so that's where I'm at now.
Very, very cool. Yeah, that sounds like it's growing really well. Awesome. That's great for you. So obviously, we're already working with a ton of teams, and everything sounds great. As a parent, if I have an athlete who's maybe just joined a team, or maybe just got some information that, hey, our team's going to be working at this facility with this, chiropractor, if I don't know anything about, chiropractic care, and I jump on Google and I say, is chiropractic care safe? It's going to be the wild, wild west, right? You're going to get blog posts about every single thing, how it could probably kill you versus how it's going to cure everything, and everything in between. So I guess, without getting into too much detail and too much depth, is it safe for, not just the general population, but let's say specifically like an adolescent or a teen who's playing sports? Is that something that, in general is going to be safe for them?
Yeah. So number one, absolutely, it's safe. But you do have to be, it's not as simple as saying that. You have to be, if it wasn't safe, no one would be doing it.
Of course.
The problem comes into play a little bit is a lot of times when people are predisposed to injury, or Even without getting too much into it, and I'm not afraid to talk about it, but even some of the cases where it made the news a couple times back with the stroke things. Well, one of the symptoms of a stroke, headache, dizziness, those types of things, you're likely to present to a chiropractic office. Similar to a couple of years back, there was actually a case where a stroke patient presented to a chiropractic office. The chiropractor identified the stroke that was in progress, called the hospital, called an ambulance, got them safely transported to the hospital, but that didn't make any news, right?
No. Good stuff never does like that, right?
So there has been, there have been studies done because people want it, of course, and I would never put my hands on anyone if I didn't think it was safe, because it's my license that's on the line, of course.
Yeah.
But yeah, over the years, there's been no increased correlation with chiropractic and stroke, or medical doctors and stroke, or going to get your hair cut and having a stroke. But you do have to be careful. And so as a parent, if I had a child if I didn't know anything about chiropractic, wanted to bring them into an office for the first time, I would say number one is identify your goals. Every chiropractor, like you alluded to, if you go on Google, every chiropractor practices very differently. The scope that we operate within is quite wide. So sometimes you don't know what you're getting yourself into. Are you going to see a chiropractor that's actually going to work with the spine? Are you going to see a chiropractor that does more acupuncture and soft tissue therapy? Are you going to see a chiropractor that's heavily focused on diet and nutrition? Those all exist. And I think what a parent needs to do first and foremost is identify what are they looking for and what are their goals for care. And before even scheduling with the chiropractor, or maybe just scheduling a consultation first, is figure out what you want and ask the chiropractor those questions. And hopefully they'll be honest enough with you to say, if they can't handle it, if they're not comfortable, if they don't practice that way, if that's not their focus, then they can set you up with a chiropractor who is and more in line with what you're looking for.
Absolutely, yeah. And would you say that are there any things that might jump out for a parent? So any maybe red flags presented by like a team or that specific chiropractor who's maybe potentially offering their services? Is there anything that we want to understand? What's the goals and what the scope is, but is there anything that they should really be careful of, or any specific treatments, any phrases, or anything like that they want to make sure that their son or daughter is going to be in good hands?
Yeah, absolutely. I usually tell parents, because we get it a lot, right? We get nice results with certain patients, and a lot of times we grow because of the referral, but we're restricted to our location. So oftentimes people will say, hey, can you refer me to someone in Guelph or London or
Yep.
And I usually tell people, if I can't find someone personally, I'll say, well, have them go somewhere, but make sure that they're, wherever they go, whatever chiropractic office it is, that the chiropractor takes the time to sit down with you first, go through a proper consultation, go through a health history, and do some form of proper examination. For me, that consists of a detailed spinal nerve analysis and x-ray analysis. That's the way I practice. Not everyone does that the same way, but there has to be some form of specific examination first and foremost with objective measurements, so that you as a parent and the chiropractor and the child know where at least you have a baseline to start out with. You know what you're trying to improve, and then you can objectively track the progress as you go. I've heard of a lot of offices sometimes that a parent will go in and I'll say, so what did they find, or what did they tell you? Oh no, well, we just they asked me a couple questions, and then hopped right onto the table, and the treatment began. Yeah. Personally, that's kind of something to each his own, I guess. I guess maybe some people want that. They want that just quick relief. They're not looking for any type of detailed report or anything. But for me personally, if it was me and if it was my child, I'd want to do a detailed exam first.
Yeah, it absolutely makes sense. We're dealing with, a growing child still potentially, and, we're working with the spine, right? So we want to, as a parent, I would definitely want to make sure that there's, a lot of information presented, and I really, really understand, what you're doing, what we're trying to correct.
And to that point too, Sean, depending on, and I forgot to mention this, depending on the age of the child, there is something called the ICPA, which is the International Chiropractic Pediatric Association. So if you do have a child that's, under the age of 12 or 13 and younger, and still really in that heavy development process, a chiropractor that's certified and trained by the ICPA would have a lot more knowledge and familiarity not necessarily how it relates to sports per se, some might, but definitely how it relates to the growing and developing spine and nervous system. Those chiropractors are fantastic at dealing with kids. They track different milestones. They do a lot of sensory testing and nerve testing, things like that. My sister actually handles all that stuff in our Oakville office. She's fantastic with kids. Doesn't come to me.
Yeah.
Those additional certifications, but she did, in addition to the regular workload to get your chiropractic degree, these ICPA chiropractors do a ton. So if you are a parent that's specifically looking for a younger child, I would look for a chiropractor that's certified by the ICPA as well. Yeah.
Oh, that's great. That's really good to know.
Yeah.
Okay. So there are definitely, certified, chiropractors out there, and it looks like it can benefit, given, certain circumstances. It's going to, help some athletes. When we're working with a team, for example, right? You mentioned the Ontario Blue Jays as one, but it could be any team. Are we looking for, specific issues within those athletes, or are we just kind of talking overall, improved wellness, right? Maybe, they're not terrible. Can they still see a chiropractor and benefit?
Yes, absolutely.
Yeah. Okay.
Of course they can. I think it usually starts with some type of injury, right? I mean, most if it ain't broke, don't fix it type of thing, right?
Yeah, for sure.
And we can talk about that later if we want to. But I think, even with parents and stuff, usually if the kid's not complaining of pain and everything seems okay, then usually you just kind of even keel. We'll just keep going with what we're doing. But it usually starts with an injury. But then after that, we try with the teams especially. We try to educate the athletes and the parents on the importance of continued care for athletic performance and optimization. Okay. The kind of landmark study that was done from a chiropractic perspective, there was a huge landmark study that was done about 2 years ago, and they were specifically looking at how chiropractic adjustments influenced the nerve conduction velocity to the nerves actually firing to the quads, hamstrings, and glute muscles. Okay. And so they were using a force plate on the ground and just kind of having people do, like, if you want to imagine in your head, kind of like a vertical jump. So seeing how much force they could generate upwards. Okay. So they would have the patient do that. They would work on the spine, specifically a lot of stuff in the lumbar and pelvic region of the spine, because those are the nerves that come out and supply all the musculature in that region. And of course they would adjust the patient and have them redo that force plate. And I think what they found, I don't have the study in front of me, but it was something like a 60% increase in nerve conduction velocity, which equated to something like a 14 to 20% increase in the actual strength of the muscle contraction. And then from a performance standpoint, that stuff leads to, effectively, because they're testing vertical jump height, led to higher jumps. So that's one way of doing it. Of course, most people think of chiropractic and low back pain and they don't realize that side of it. But because you're working with the spine, the nerve system controls every function of the body. Of course, if you can do things to optimize it, to stimulate it the right way, to keep it healthy, of course, the body's going to function better. Yeah, no, that totally makes sense. And so if I'm a coach, let's put my seat in the coach's chair here. If I'm a coach and we have a high-level team, right, or, some of my athletes, they're looking to go to college and get scholarships, get signed to, D1 schools or something, is this something I could look at? And maybe no one's, mentioned anything about injuries. You have a fairly pretty healthy team on the surface. Is it possible to consult with, someone like yourself and say, hey, is there anything we can do to kind of assess our team as a whole and, just see if there's any improvement, right? I mean, at this level, if we're talking kind of the top level, sometimes that, small percent of adjustments, maybe you get an extra mile an hour on a fastball or a little bit more drop or something like that, then, that can make the difference of, getting signed or not, right? Or making that, school or that high-level team or whatever that looks like. Is that something that we can just, come to you and say, like, hey, here's my team, here's my situation. Is there any way we can help? And that's what we're doing. Awesome. With the, now it depends, of course, that comes down to a budgeting issue with the team, of course. Right? Of course, yes. But in our Mississauga office there, because of the amount of space that we have, it's more than just a chiropractic office if you're visualizing that in your head. It's actually a 16,000 foot indoor training center. So we do have teams that sign up for, and it's not just with us, there's a whole other side of the things without getting too much into it. There's strength and conditioning coaches, there's a whole bunch of things there. So teams actually do sign up for what we would consider like a gold or platinum package. And they would come in, and not only are they doing the strength coaching, not only are they doing sport specific training, but they're also getting baseline assessments done by us. And right now, because that facility is only about 2 years old, it's still in its infancy. But right now, what that consists of from the sports medicine side, the chiropractic side of things, is we're primarily just doing an injury prevention screen. It's sport specific depending on what for the team, depending on what sport it is. Again, right now we are servicing a lot of baseball and volleyball teams right now. So it's sport specific that way. But we're just doing a general injury prevention screen, and what we're doing is looking at these athletes. Number one, if they're hurt and they're in pain right away, we're trying to fix that. And that's what the organizations and teams are asking us to do. So we're working with some people right away if they already know what their injury is. But other times we'll look at people and, depending on what muscle asymmetries might present or what type of imbalances they have, strength imbalances, things like that. And we're noticing these things and we say, well, if we don't work on something like that, you're susceptible to an injury in this arm or this shoulder or this leg. And, it's easier to work on now. And hopefully we can start to get things moving a little bit better so that hopefully as your season progresses, you don't end up getting injured and missing time.
Yeah, that makes sense. Yeah.
Those more elite levels. We're primarily doing these baseline tests during the off season before the season begins, so that we can work with these athletes so that hopefully we can keep them on the court or on the field through the entirety of the season versus ignoring these things. They get hurt mid-season and now they've missed the rest of the year. So that's kind of where we're at with that. But yeah, absolutely. Depending on the level of the team and what their goals are, it would be absolutely beneficial to try to do like a team screen like that and get people as healthy as possible before the season begins.
Yeah, awesome. I mean, just looking at something like that, you can kind of see how, that could just make the difference between, make it real broad, winning and losing, right? I mean, if you got a little bit extra out of everyone, then, it can really elevate that team.
Of course.
Awesome. I mean, this is going to be a little bit tough to kind of convey, I guess, but have you seen any, specific improvements, say with a certain player who is in that situation, who maybe doesn't have a pre-existing injury and isn't coming to you with low back pain, and I'm just kind of looking to get the most out of my athletic career here? Any specific cases you're able to highlight and just kind of say hey, we've seen this athlete go from, X to Y here?
Yeah, a couple of them actually, and they'll jump out right away. It's rewarding when it happens, when you have a specific. Oh yeah,
absolutely, yeah.
As the parent, if you can identify what your goals are for care specifically before you begin care, then once you achieve them, it's amazing. So we had, and I'm not obviously patient thing.
Oh, of course, yeah, no names, yeah.
He was a former Ontario Blue Jay athlete. For anyone that's not familiar with that program. The program runs from about 12 years old to 18 years old with the goal of, it's one of the largest youth baseball organizations in Canada. And the goal of this organization is to set players up for some type of scholarship, whether it be D1, whether it be a junior college in the States, whatever it is. But the goal is to get these athletes ready so that they can get some type of scholarship in the States to play ball. And then after that, a lot of them do end up getting drafted to the MLB. So we had a former Ontario Blue Jay alumni. He comes back and trains with us in the summer. He plays down in Louisiana for the time being while he's in school. And he's a pitcher. And his goal was, he wasn't necessarily in any pain or anything like that, but he came to us and said, I have to increase the velocity on my pitch. Or I'm not going to get drafted high, or maybe not get drafted.
Maybe not at all. Yeah.
So that was his goal, and we said, okay. So from a chiropractic standpoint, I began working on specifically the cervical and the upper thoracic spine. Again, that nerve supply comes off and controls all the muscles, all the innervation down the arm. Okay. He was also working at the time with one of our physiotherapists who was working on the rotator cuff and all the specific musculature around the shoulder to try to keep things as loose and as balanced as possible. And I think we slowly track his pitch velocity. It's an easy objective number to track. And by the end of our week, we kind of set up a goal. We had an 8-week program of care, and by the end of the 8 weeks, he was throwing the fastest that he's ever thrown before. I think that's a big missing link. Once you have your child get to that level where they're kind of on the brink of elite athleticism, so to speak. So many times, most for that, to use that as an example, most pitchers will say, I got to throw harder. So what are they going to do? They're just going to whip the ball 1,000 times and maybe hit the gym and try to strengthen their arm. When in reality, if you're not recovering properly, if you're not nourishing your body properly, if you're not taking care of your spine, your nerves, the muscle symmetries, the muscle imbalances, those types of things, if you're ignoring all that stuff, I don't believe you ever reach your full potential. So you can whip the ball 2,000 times a day till your arm falls off. I don't think you'll ever get there if you're ignoring those other things.
No, that makes sense. It's very, very cool. Showing how that you can kind of maybe take it to that next level. So I think, and basically what it sounds like, and, I'm sure you will agree that with anything, whether it's a, chiropractor, a dietitian, personal trainer, or anything like that, I think it really just comes down to doing your due diligence, doing some research, talking to maybe some, trusted individuals that you may know, or kind of getting referrals from that chiropractor, and just making sure that, whatever reason that your son or daughter may want to be, talking to or getting treatments, is that we just understand what they're going to do and what the possible benefits could be, right? We talked about injuries and kind of helping and fixing those, or just better overall wellness and maybe kind of reaching that next level.
Of course.
Yeah. So if someone is out there watching or listening, where can we find more information about Dr. Jason, Foundation Matrix? Where can we get some more information?
You can find me on either one of my clinic websites. So my main office, foundationoakville.com or .ca, foundationoakville.com. You'll find my bio, my information, my blog, everything there. apexmississauga.ca is the Mississauga clinic. That's the Ontario Blue Jays, and that's located within the Athlete Matrix. You can also look up the athletematrix.ca or .com or whatever it is. You'll find us there. And then we do, in today's day and age, of course, we're pretty heavily involved in social media. So you can follow at Foundation Chiropractic Co. And you'll find me there as well. So, yeah.
Is there any, last words, anything you want to kind of put out to the parents and the coaches listening, anything that you want to kind of leave them with here?
Something that I see is the parents and the kids, especially, again, once you get to that elite level, you're so focused on strength and you're so focused on jumping higher and running faster and hitting harder and all those things. And you kind of neglect your body until it becomes an issue, right?
Yes.
So making stretching and recovery part of your normal routine after you've just competed and maximally exerted all your muscles and all that stuff. Having some type of recovery routine, some type of cool down, stretching on a regular basis. I think that's the biggest missing thing. So a lot of times you can even prevent some of the stuff to have to go to a chiropractor sometimes, right? If you just educate yourself a little bit better and take better care of yourself. And we do that with our patients in the office. So we don't, hopefully this doesn't become a recurring issue, but parents just need to be aware of that, I think, is just, watch your kid, make sure you're encouraging them to stretch properly, to cool down, because no kid wants to do that. It's not the fun stuff.
No.
But it's the necessary stuff.